Yeehaw! Welcome to the Grin gang. Today you will learn all about sterilization. Yay!
Get ready to put your thinking caps on!
Yay!
Since the dental assistant will be in contact with contaminated items, proper PPE is a must. This includes masks, gloves, protective eyewear, and a PPE gown. Using nitrile gloves, we will take our transport bin to the sterilization room and place it in its proper zone. To prevent cross-contamination, the sterilization room has a clear one-way workflow from dirty to clean. This red zone is an indicator of where dirty instruments must be stored. After placing the transport bin into the designated red zone, we must wash our hands and then re-glove. Hands can carry bacteria from previous patients or the environment, which can be transferred to instruments if not washed properly before sterilization. Now it's time for the instruments to be cleaned. Blood, tissue, and any sort of residuals can be in hard-to-reach areas, so all instruments must be cleaned thoroughly before being sterilized. We use utility gloves to remove the dirty instruments from the red zone. Utility gloves protect us from any potential sharps incident that may occur. The dirty instruments must be organized now into their proper cleaning equipment. The cassette will be cleaned using the hydrum. The hydrum utilizes detergent to check to see if it needs to be either refilled or replaced. You can locate the detergent here. The hydrum runs for 27 minutes and must reach 180 degrees in temperature. Loose instruments are placed in the ultrasonic cleaner. The ultrasonic is used to remove debris and biofilm from dental tools by using high-frequency sound waves. When adding water into the system, make sure to fill the water to just under the 3 dots. Just like the hydrum, the ultrasonic utilizes a cleaning chemical. Instead of detergent, it uses 1 cleaning tablet per load. To properly clean the instruments, the SATA must run for about 10 minutes. Since handpieces are much different from the other instruments, we must never place them in machines such as the hydrum or ultrasonic. Instead, we clean them using the Sterling that simultaneously cleans and lubricates them. The Sterling oils and removes any remaining material in about 2 minutes. While these run, now would be a good time to wipe our transfer bin down using a cavi wipe. Make sure to never place the bin down while wiping. In dental offices, transport bins should be wiped down to prevent the spread of infectious diseases and protect patients, dentists, and other dental team. We will now place the bin into the designated blue area. This signifies that the bin is clean and ready to be used. Setting aside our utility gloves, let's find the right sterilization pouch for each item and mark them. Each pouch must include the initials of the assistant, the date, the correct sterilization device, and finally, the number of the load. By this time, most of the devices like the ultrasonic and Sterling will complete their cycle. Handpieces will be taken, wiped with a caddy wipe, and placed outside their packages to dry. Loose instruments will be removed from the ultrasonic and placed into the dryer. It's important to let wet instruments dry, or else the pouches will be destroyed and wicking will occur. The dryer ensures that they are completely moisture-free before being placed in the sterilizer. This will run for about 2 to 5 minutes. Now we will remove the cassette from the autoclave and immediately place it in the pouch. Make sure to properly seal each pouch. Before loading any pouches into a designated sterilization device, you must check the water supply for each one. They can be located in these areas. If the water levels are low, we can fill them up using the water hose. Remember, if there are any problems or questions concerning each device, the instruction manual can be found here. Pouches will now be placed either in the autoclave or the statum to be sterilized. We must never load our pouches into any device without using our utility gloves. The outside of a sterilization pouch is considered potentially contaminated, so utility gloves act as a barrier to prevent direct contact with your hands. When loading the autoclave, place pouches paper side up and make sure that they are not overlapping. The autoclave will sterilize the cassette and loose instruments for 45 minutes and must reach 275 degrees. Instruments like the handpieces and their attachments will go into the statum. Unlike the autoclave, pouches placed in the statum must be placed paper side down. Again, make sure that the pouches are not overlapping when being loaded. It will take 12 to 14 minutes for wrapped instruments to sterilize and 3 minutes for unwrapped instruments. However, the stata must reach 275 degrees. While everything is running, we must record the load we have just started. Our record should include the date and time of the sterilization, the sterilizer's identification number or brand, the person's initials, and the type of sterilization. This documentation is used to ensure that the temperature, time, and pressure were met during each cycle. If a sterilization device should fail, this record can help identify which instruments might have been affected, essentially acting as a safeguard. After washing and re-gloving, we will now retrieve our pouches. Now that it's time to retrieve our pouches, we will use nitrile gloves rather than utility gloves, since the items are now considered sterile. Each pouch must immediately be stored in the blue zone. Biological monitoring, also known as a spore test, is a weekly process that assesses the sterilization of dental instruments by killing microorganisms. To do this, we must place the biological monitoring vial in the sterilizer. After being run through a cycle, we will place the vial in an incubator and break the seal. In-office biological monitoring can detect spore growth anywhere from 10 to 24 hours. Make sure to keep accurate records of the test results, including the time and date of both the results and then the eventual control. Remember, this is important because it shows the sterilizer's ability to kill organisms. This prevention helps to protect patients and staff from disease. Now it's time for the daily and routine maintenance of the sterilization area and equipment. This not only prevents contamination of sterile items and ensures patient safety, it also prolongs the lifespan of the equipment before they become major problems. An example of daily and routine maintenance would be to empty the ultrasonic after every use. This prevents cross-contamination between patients by removing any residual debris, blood, or saliva that may be present in the cleaning solution, ensuring that the next set of instruments are properly cleaned with fresh solution and not exposed to potentially infectious material from previous patients. Now we will wipe down our surfaces. Wiping down surfaces after using them in sterilization prevents cross-contamination by removing any microorganisms that may have been left behind, guaranteeing a clean and safe environment for further use. Congratulations, partner, on completing sterilization. You are now a part of the Gritty Grin gang.